What are the biggest myths or misunderstandings about cataract surgery?
So there is a lot of misunderstandings and misconceptions about cataracts and cataract surgery. Cataracts will never come back. It's your human lens that we've removed. So you don't have to worry about getting another cataract. We may get some fibrosis of the capsule holding the lens, and that may require a subsequent laser treatment to eliminate that cloudiness that can be added to the vision. And that's fairly frequent, 30 to 40% within 2 years, depending on which study you look at. But it's a simple fix. Basically, we're just opening the posterior part of that capsule like we open the anterior part of the capsule to do the surgery, but we're doing that with a laser, and it's a couple of minute procedure in the office. Today, with modern equipment, your surgeon should know if indeed all of the cataract was removed. If all of it was not for whatever reason surgically, that lens will continue to grow and it will need a secondary procedure. This is rare, but very knowable. So other than that, the cataract's never coming back, so you don't have to worry about that. Second, the lens itself, the intraocular lens, is not going to change power, but it can still decenter or tilt or any other type of problem if the capsule itself is not strong enough. So there it's important to know beforehand if we have one of those weaknesses of the capsule. Pseudoexfoliation is the most common one statistically, and that can be up to 10% of the population depending on genetics. But again, that's something you know beforehand. The other misconception is that the monofocal lens, simply having routine cataract surgery with a monofocal lens, is not correcting your vision. It's averaging your vision close as possible to zero. But if you have astigmatism, it's not correcting that astigmatism. And the lens itself is not focusing, it's a fixed lens. So it is not changing focus to give you any different visions. It's designed to work from about 3 feet to 50 to 100 feet and beyond in that range, but it's not precisely focusing you. So with a monofocal, we'll be using glasses to achieve that. With a vision correcting lens, we still need a functional pupil, and we still need the rest of the eye to be healthy. So sometimes your surgeon will tell you that a certain lens is not a good choice for you because of some other problem in the eye. That's what your eye is, that's okay. We'll pick the best lens that fits your eye. Also, the cataract is the problem at the time, but it doesn't prevent you from developing any other eye problems in your life, such as retinal problems from diabetes or potential glaucoma over time. So there are other eye diseases that you may have to encounter or already know about heading into the surgery. These do not go away simply by doing the cataract surgery. So we have to address that throughout your life to make sure your eye stays healthy. But the lens itself is not going to change, and it's going to last. So you can count on its performance. And that means you are making an informed decision of what you want that performance to be heading into the surgery today. We also have the ability to use lasers in surgery to help correct astigmatism and do some other parts to assist in the surgery. So that can sometimes be a good adjunct for you as you plan your surgery, depending on the amount and location of your astigmatism.